Chapter 4: A Look Forward. So because the elderly are living longer than normal, the prevalence of chronic diseases associated with aging have increased. Chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the U.S. Most chronically ill patients account for the majority of healthcare spending, both by the government and their own spending. By 2050, the population will be more ethnically and racially diverse. This will influence the environment for new healthcare workers and a diversity of those needing care. Chronic diseases of today are associated with personal lifestyle, such as physical activity, eating habits, smoking, alcohol and drug intake, and personal hygiene. Clinical prevention services are being used more as a result of requirements to include preventive services by insurance plans. This includes immunizations and cancer screenings, and they are the most common preventative services. Diseases and health problems can also be greatly influenced by the environment. Globalization of international travel increases the risk for infectious diseases, and new organisms can appear from mutations and can be transmitted through wild animals. New organisms can appear from mutations and can be transmitted through wild animals to domesticated animals and then to humans. Those are called zoonotic diseases. An example is Ebola and avian flu. Some ways that the country was unprepared for the pandemic of COVID-19 was a lack of needed personal protective equipment, or PPE. For example, this includes masks, gloves, gowns, and a lack of a quick and reliable test to identify infected individuals. Through COVID-19, however, telehealth became a common way to deliver healthcare during this period of social isolation. Finally, MRSA is present in hospitals and nursing homes, both in the community. This disease causes skin infections and sepsis in hospitalization patients.